There has been a decline in the overall number of daily reported COVID-19 cases since February 6, with a total of 3,288 new cases reported by the Health Ministry today. Is the drop in daily cases a true reflection of reduced transmission in the country? According to a report by health news portal Code Blue, this is due to a consistent decrease in the number of COVID-19 tests being conducted. Here is what Astro Muhammad Khalid, founder of Galen Centre for Health and Social Policy, has to say.
Well, we would all be sighing with relief if it were an accurate picture. But the drop in yesterday's reported cases may not be an accurate reflection of reduced transmission of COVID-19 in Malaysia. And for two reasons. Testing numbers have declined over the past week, while the positivity rate has remained consistently above 5%. The Ministry of Health data actually shows a steady decline in the number of people tested for COVID-19. For example, for 8th February, the DG yesterday mentioned that only 30% of current RT-PCR capacity was being utilized out of a total capacity of more than 76,000. So as far as we are aware, testing has not ever gone beyond 70% of capacity, and that there have also been surprising changes in testing protocols, which also seem aimed to reduce testing. We need to increase testing, not decrease testing. I don't think we really understand this reduced testing strategy and what it's intended to produce. So one of the things that we hear quite a lot about is the R naught values. And rather than swinging on the roller coaster of R naught values, the government should really depend on positivity rates for its policy decisions. When I refer to positivity rates, these are the percentage of all COVID-19 tests performed that are actually positive, or positive tests divided by the total number of tests times 100. Positivity rates gives us an indication of how widespread infection is in an area where the testing is being conducted, and whether levels of testing are keeping up with the levels of disease transmission. So a higher rate suggests higher transmission, and that there are likely more people with COVID-19 in the community who haven't been tested yet. So it means that there are more undetected COVID-19 cases in the community. And this is a valuable epidemiology tool, especially when applied to the individual states.